World Stroke Organization reported brain stroke is the second leading cause of death, and it is one of the major causes causing long-term disability. And 87% of the strokes are ischemic stroke. Hello everyone, welcome. This is Dr. Harathi Bandaru. So what are the risk factors for this stroke? High blood pressure, hypertension is the most common risk factor of the stroke. And in addition to that, diabetes, high cholesterol, smoking, obesity, lack of physical activity, sedentary lifestyle, and any irregular heartbeat of like atrial fibrillation. These are the most common risk factors of the stroke. So how do you identify? What are the symptoms of the stroke? The acronym is B FAST. B for balance problem. Any significant dizziness, significant balance problem. And then E, vision, eye problem, double vision, vision problem. That is E. F, facial droopiness. A, arm weakness or leg weakness. S, speech problem. That is one of the most important. If you have any speech problem, it's very important to be checked. And the last one is T. T. What do you mean by T? Now, when you have these symptoms, now it is time to call for help and call for emergency services. Okay. Then why it is important to go to the hospital as soon as possible? Why? Do you know? 1.9 million cells, brain cells die every minute after stroke. So if you get early treatment, you can save brain cells. And one more important thing, if you reach the hospital within 4.5 hours, the magical time, you can qualify for thrombolytics, clot busting medications, which are the medications which are given IV to dissolve the blood clots and save the brain cells, thereby reducing the disability. So it is very important to seek medical help on time. Then what else? In the hospital, you'll get MRI. We will make sure you get adequate treatment. You will be started on aspirin, cholesterol medication. And other important thing is make sure your stroke is not coming from the heart. So that's why you need to check whether you have irregular heartbeat, which is also called as atrial fibrillation. If you have atrial fibrillation, then the treatment plan changes. Okay. Then what can you do from your end to prevent future stroke? Number one, be consistent and compliant with the medication. Number two, make sure you do regular exercise. Number three, neuro rehab, physical therapy, occupational therapy, speech therapy. They play a very important role in the neuroplasticity and early recovery, especially after stroke. Number four, again, make sure you control your blood pressure, make sure you control your diabetes and cholesterol. Number five, limit alcohol, avoid smoking completely. Number six, sleep, very, very important. And if you snore, if you have sleep apnea, it is very important to mention to your doctor, because correction of sleep apnea with CPAP helps in the longevity of life and it prevents future stroke. So it is very important to let your physician know if you snore and if you have sleep apnea. If you find this information useful, please do share, subscribe and share with everyone. Thank you so much.